This is Duke University.
And I'm Albert Hu. I'm junior in the biomedical engineering program. This summer I did microfinance projects. I did a microfinance internship at a credit union in Uganda, Uganda. And I'm just gonna talk through the process of me joining the program and what I did and what I'm doing right now. It wasn't a hard decision. Towards the end of the last year, I was looking for service opportunities in a different culture. I was looking towards I was comparing between a couple of established programs at Duke, including the Engineering World Health, Duke Engage, both individual projects and different projects. There's actually a microfinance project in Uganda from Duke Engage. I reached out to different professors and friends and older students that I've known who has done different kinds of work in Africa or any part of the world that I felt was interesting. And I was exposed to the DMI, the Duke Microfinance Leadership Initiatives internship program in Uganda because one of our alumni, Jade Lamb, was an intern in Uganda last year, and she blasted our email listserv and telling us about this opportunity that she's recruiting for. And I thought I read a brief description which didn't tell me much about it, but I thought I would give it a try, and then I'm glad I did.
And Jade was a university scholar in the Stanford School of Public Policy who just graduated last year.
Right, you're gonna see her picture. No. So I was interested in entrepreneurship, and I was interested in environmental technology, and sometimes in my environmental policy too. And so I went to the interview and asked them what I could do, and I was really glad to hear that I could pretty much do anything I wanted, as long as there's a need for that. So I basically just signed up for it. And I chose it because it had a very flexible time frame. Unlike Duke Engage or Engineering World Health, I could discuss with my colleague when we want to be in Uganda, when we want to leave, and if we're gonna take breaks in between. So there was lots of space to explore. The program is not well established yet, and there's really no supervisory role in our program, so you could basically go off on your own for a couple of days without any supervisors, and I really liked that space of exploration. And I also liked Uganda as the location and the fact that they spoke English as their official language, even though I did learn Luganda because I did felt the need to know their local diet a little bit. But I really think to do any service project, if you don't know the language at all, it could be very difficult. So I want to talk about why it's related to my interests and my academic interests and me as a person. So this is actually this is a preparation for leaving for Uganda. We started out by talking to past interns about what they did in the past years, and we focused on learning the relationship between the interns and the credit union and the community, as well as the local people. There was a lot of training sessions that we did here at Duke before I left. We had weekly meetings that went over a lot of concepts. And we basically talked about what our expectations were as a group. And we also have to apply for funding, which in our case was a lot easier because we had university scholarship funding lined up for it. Finally, we did some goal settings and did some planning as what do we expect to accomplish in what time frame. and we learned some Uganda even before I left. And then for any international travel, we had to prepare. This is more for undergrads who were looking for to do things abroad. So it may not apply to everyone, but we had to get health insurance, visas, get immunizations, and arrange our travels. And I found I made a mistake by not telling my family until pretty late during the thing. So that's something you should avoid. And getting all the equipment. And most importantly, you need to have a heart to explore. So now we talk about how it's related. So I'm really interested in non-profit ventures. During my sophomore year, I did quite a few case competitions and startup challenges about how to improve people's lives in developing countries. And I thought Africa is a very interesting continent that I've never been to, and it's very important in biomedical engineering as well, as I see a lot of applications and research done at Duke geared towards the African population. And I also have interest in energy, clean energy and environmental technology, which I thought could be applied to Africa as well. And last night, I really wanted to learn about the healthcare reform in Uganda that's going on right now. So here's a little video about what DMLI has been doing in the past years, and I and my colleague made this video during our time there, and so let's take a look.
Uganda is a country known in the West mostly for its turbulent past. The insurgency of the Lord's Resistance Army is long over, and the people are more optimistic about the future. I went to Uganda during the summer of 2012 with my friend Albert in order to witness what the British call the Pearl of Africa. The people who we met were working hard to build a future for themselves and their children. Almost all the people we came into contact with were very welcoming. But what was most noticeable was that they had great entrepreneurial spirit. This is the story of how the Duke Microfinance Leadership Initiative has been helping to develop microfinance lending opportunities in a small town in Uganda called Nkopunjo, located just 2 hours west of the capital, Kampala. For the past 4 summers, the Duke Microfinance Leadership Initiative, or DMLI, has had a partnership with a credit union in this town. This credit union is called SACCO for short, and it stands for Savings and Credit Cooperative. This organization is different from the bank in that it is completely member-owned and not-for-profit. With the help of Duke University students, the SACCO has had much of an impact in helping locals develop businesses and to raise farmers out of poverty.
That's Jade.
In the past, Duke University students sent to Uganda through the DMLI have had much success in helping to expand the membership of the SACCO and to develop its capabilities as a microfinance lender. So the work of DMLI interns involved going from village to village doing mobilization work, and this involves asking villagers survey questions about their financial situation. These questions will normally be sensitive by American standards, but the villagers that we've met were not shy about giving us their best estimates about their spending and saving patterns. The results of the survey were then analyzed in order to help the SACCO develop new products that they can offer to help the local community.
Typically, what has been the case is that students have come back with data, with new ideas about the way the organization works and what it does well, what it doesn't, and new ideas about products, about how to deliver a service, that sort of thing. And I then match them with a faculty member that has some expertise and interest in microfinance, and they work on an independent study. And what students should know is that you don't have to have everything worked out. but you do have to have a good idea and some sense of what your agenda would look like in order to be more successful.
Kokongero in our language means white chicken. Yeah, so it is a place that has hosted foreigners for many years because it has a good reputation of having it has a big influence of the Catholic presence. Missionaries came here and helped develop this area, so we had a good experience with foreigners. People are very friendly with foreigners. But the past 4 years, due Yamara in terms of working with us to help build the capacity of the Kokongero Circle. When the first group came, that people Gloria and Dan Kobayashi, they helped us to do mobilization because by the time they came, the circle had about 280 members. But when they came and we did mobilization with them, we had rapidly increased the membership. That after 3 months, after 3 months, membership increased up to 800 members, and then currently we have over 1,300 members. Another group came, that's joined us to do financial literacy classes, members, and also building capacity of our staff, the circle staff, be able to do proper recording, computerized recording of financial documents, and also building their typing skills.
The last group is that of Lamjel, here, and the likes of Fred. So they also did a great work of organization, great work of documentation, great work as in trying to help the institution have the records in place and stored well. So those people did what we call mobilization. To go with them in the field, mobilize the more members, and you need more people joining the institution during that time.
People have now built trust in the circle because they know that if Muslim all the way from America can come to help develop this circle, then it means that this circle has credibility. Otherwise, if it had been not a good institution, it would not have encouraged Americans to come out. So it's good. And we can people know that in the beginning, when our own portfolio was still very strong, DMR was significant to improve on the own portfolio. And all members know that. So whenever they see Zobo coming from America to help work with the circle, people really have a lot of trust that the circle is providing community service to them.
Do you think the circle would be where it is today if you did not have this partnership with the Duke Michael Mines Leadership Initiative?
No. We wouldn't be where we are today because first and foremost, our loan portfolio was very small. But when DMR helped us with the loan portfolio, so we had money to lend to members, and we are also paying that. And secondly, we did great mobilization work when DMR and they helped us with mobilization. And the number of members more than doubled.
Do you welcome the Duke interns who will be coming next year?
In fact, I even welcome like 100 of them next year because what we will gain from the past interns is really a success to the institution, and we also believe that the spirit of internship should be strongly emphasized. I take this opportunity to actually thank the recent interns. They've done some great work for us, and I hope they transfer the same information to to the next interns to come so that we also have some regular with us.
Uganda, and especially the town of Nkokunju, is home to some of the friendliest people I have ever had the pleasure of working with. Much was accomplished during the 2 months Albert and I were there. Many memories were created and good impressions were left. Our colleagues are looking forward to the next group of Duke students to continue the effort to build up the capabilities of the credit union and to make their own mark in Uganda in the summers to come.
So we made this video mostly to recruit more undergrads to sign up. So if you're watching this online and you're interested, please send me an email. I want to talk a little bit about what exactly I did and what was my project. So first and foremost, our number one project there, this is something we had in mind before we went there, was instant credit medical payment plan. This is a direct result from our service and research. We basically started our days in Africa by going door to door, asking people questions about their saving habits, their family situation, and their health situation in general. We designed this plan to address several issues that were identified through these surveys, and they are first of all, they don't have available funds. They don't have savings. Basically, if you're average Uganda, you have some money you invest into chickens or agriculture products, and you will not have money available if you need immediate medical attention. And not everyone is eligible to enroll into traditional medical health insurance because the community health insurance that are in place today require a 60% enrollment from each village in order to avoid negative selection, which means only the sick will enroll in health insurance and the healthy won't. Also, people tend to seek healthcare really late in the course of the illness. Many go to witch doctors for weeks until they really can't handle it anymore, and then they go to professionals because it's very expensive. So with the instant credit payment plan, I'll explain what exactly the terms are. It encourages people to seek treatment early instead of later, which actually translates into financial savings. Also, we had our plan at a regional hospital, and that's only valid at the hospital. So this way, we encourage people to come to a credible service provider instead of going to any street clinic. So how the plan works is a member of the credit union would pay a small annual fee to enroll in this plan and get their membership card. With this membership card, they can go to that specific hospital and get treatments without paying upfront. They will then be given a 3 month grace period where they don't have to pay anything, and at the end of 3 months period, they pay back the entirety of the cost of their service. And the SACCO, the credit union, uses the annual fee in addition to a percentage discount from the hospital to cover the interest lost over the 3 month period. So this way, the SACCO benefits from the increased loan business and a premium membership benefit, which draws more members, even more members, to become a member of the credit union. And the St. Francis Hospital, which is the regional hospital that was chosen, also benefit from this plan because they get increased patients. The other project that was proposed last year when Jade was in Uganda and we sort of finished off was a mobile banking project. The credit union upgraded their system and made all their records transfer all their record from paper to electronic form, and MTN mobile telenetwork was the #1 cell phone carrier in Uganda, and we proposed a business plan of transferring our records onto their network so members can access their funds in their account, in their SACCO accounts, by text messaging. And they took the initiative and issued us special SIM cards which were linked to the credit union accounts. So we were really happy that we were physically there when that happened. And it's kind of sad that Jade and her colleagues wasn't able to be there to actually witness this happening. My third project, which is something I did on my own as a side project, was a solar stove. I'm sure you saw that in the video I was playing around with a solar stove, which looked like a satellite dish. I basically went to their weekly market meetings and I put my solar stove there along with other vendors and who were selling vegetables and stuff, and basically showing everyone how solar cooker works and giving out everyone free tea. It works very well in Uganda. Not so well in the rainy seasons, but even though it was rainy season, we were able to boil water and cook beans without burning any wood, and it's free. So I think it's a very viable business, and I got the solar stove for only $50, and there were villagers who were willing to pay more than $100 for it. So I thought that's something we could work on. Even though I have left Uganda right now, but I still have plans as how DMLI involvement in that village can be greater, or how I can be more involved in the projects. And right now I'm recruiting for next year's interns, and I'm trying to raise money for 3 orphans who lost their parents in a water accident as soon as we left Uganda, and their house was right next to us, where we were living. I also plan to expand the medical payment plan to other villages. Towards the end of my trip in Uganda, I went to a couple other villages in western Uganda, and the village is set up exactly the same way as in Gogo-Njeru, where there's a non-profit credit union, there's a non-profit hospital, and there's a need for medical, for putting the risk of medical cost. I'm trying to apply for some grants to expand that plan. And I'm thinking about ways to turn that solar stove business into a viable business where I can provide jobs for local people, in addition to helping them conserve their forest. And perhaps capturing pony. I don't know. And I'll take any questions.
Are there questions? Ihan?
Mine's quick and flippant. Any fun immunizations?
Any what?
You said you got immunizations.
Yeah.
Any fun or interesting ones?
Yeah. So apparently yellow fever, which was recommended for every African trip, is not necessary. We went there. I actually specifically asked the doctor, how many people get yellow fever here? And he said, I have not seen that in many years. Because that shot really hurts. That's why I had that shot really hurts, and try not to do it. They don't require it, so.
So again, I have 2 questions. The first one is about the solar stove. Is it possible that the stove can, there could be a kind of collaboration set up so each village or each 2 apartments will be able to share a stove, so it's more cost effective, or it's a better use of resources?
Okay. I thought I had another idea that was a solar hot water system, and I thought that could be shared by multiple families, but because people live pretty far apart and the housewives spend a big portion of their day cooking food, I think it might be difficult to share a single stove for between 2 families. But it actually doesn't cost that much. The stove cost me like $40-something, and the burning wood actually costs quite a bit in Uganda. And even though most people don't have the time to actually go into the forest and cut down themselves, so they actually buy it, and they're increasing in price every other week. So I think it makes financial sense for people to get a solar cooker too.
Okay, second question, not to be offensive, aggressive, or rude, but do you feel like you fit in with the way you dressed? At least how you were portrayed?
We had to dress. Everyone at the bank dressed up pretty nicely, and in general, Ugandan people dress very nicely, I have to say, or at least they try. Which I was seriously surprised. I got to Uganda and I look on the street. Every man is wearing at least a dress shirt, and if not, suits. Even though some of the suits don't match, but they're still wearing suits and they're still trying to dress up really nice. And in the village, even in the village, the mechanic who fixes cars will be wearing like suits. So I was really surprised, and maybe that's just a culture in that area of Uganda. But in the bank, I definitely had to dress up, wear at least business casual.
If I wanted to get that YouTube video again, how would I find that?
I can send you a link.
That would be great.
It is not public, but I'll send you a link.
Ah.
Okay.
Other questions? Chris?
Would you mind if I published that link on the blog?
The US people, that's fine.
Cool.
Please do.
A really neat set of activities, Albert. So it seemed like the organization was in very good shape, and I was curious, what are some of the challenges the organization faces? I mean, they obviously have an advantage getting resources, both tangible as well as the human resources of Duke students. But what are some of the challenges they face? Defaults? What are the sort of regulatory challenges that they face in Uganda, and such as that?
Are you referring to the organization as in the SACO in Uganda?
Local, that's correct, yeah, your local partner organization.
Local partner. Okay, so I personally, so there's two organizations that I work with, is the Rural Agency for Sustainable Development and the Credit Union. The Credit Union is doing pretty good on its own. It's pretty sustainable, but I see their business model being a little outdated though. They're charging quite a bit of service fees from their members, and they're right now having a little hard time gaining more members because there are competing financial services now. Whereas the Rural Agency for Sustainable Development is really not as sustainable as it sounds. They are getting a lot of external funds from different universities in America and different organizations in the United States, and their products does not directly translate into funding that can support themselves. But other than that, they are pretty resourceful in terms of our local partner. The director you saw on there was running for the mayor of the city, and we had. So yeah, from an intern perspective, most things are set up.
Okay, I think just in the interest of time, we should move on. So thank you again, Albert.
Thank you.
Produced by Duke University, online at duke.edu.